Hi everyone, I'm Dr. Amna Husain, board-certified pediatrician, board-certified lactation consultant, and mom to 2 girls. Today we're going to be talking about why do kids drop naps? Alright guys, I have a 5.5-year-old little girl. I have a almost 2-year-old little girl, and one has just recently dropped naps. The other one is still napping, but we are going through a nap regression, and I want to talk to you guys about why kids drop naps, the most common ages they do, and how we can possibly prolong those naps, or you can decide if the nap's not working for you. Now, research finds that the age that children drop naps can vary drastically. It can be 2 years of age, it can be all the way up to 7 years of age. Now, a meta-analysis from 2020 found that 2.5% of kids usually stop napping by age 2. That's a really small number. But let's talk about the majority of kids. About a third stop napping by age 3, half by age 4, and then majority stop napping at 4.5 and then 5.5. And again, my oldest fell somewhere between the 4.5 and 5.5. Obviously, you don't need me to tell you that napping is super important for kids. The American Academy of Pediatrics has laid out what are the guidelines for children in terms of age for their sleep needs. I'm going to put those points down here. You can screenshot them, you can pause them, you can hold on to them so that you have that in mind. Now, how children meet and reach that sleep quota can vary. Some will get it all overnight with a short little cat nap or 2 in the day. Some might get longer naps during the day and then get 10 hours at night. It all can vary, obviously, depending on your age and depending on your child. We're going to get more into that though. So let's talk about what factors might determine a child to stop or drop a nap. Well, the first one might be their parents' take, right? So a nap is really only as important as potentially the effort you put into trying to preserve it. And I don't mean that in a controversial way. I mean that studies have shown that kids are more likely to keep napping and nap routinely or consistently during the day at the time they're supposed to if the parent really tries to emphasize and work around that nap. Now, that doesn't always have to happen all the time, right? But most of the times, if you try to at least make the nap a priority, then the kid will typically nap at that routine time. I've seen this alone in my house with my second, right? So my oldest, I was always trying to make that nap work perfectly for her schedule and then schedule all of our activities around it. Now with my second, that's not always possible. Maybe I've cooled down a little bit as a parent too. So her nap is shifted around a little bit and I don't sweat it, whereas I sweated it a lot more with my oldest. So I can see that changing with multiple kids involved as well. Second thing, siblings, right? So I mentioned with my second, I'm not able to really focus as much on nap routine and consistency. And sometimes, especially if your child is sharing a room with another sibling, the older sibling's not napping or potentially serves as a distraction, then perhaps the youngest won't be napping as consistently or routinely as well either for a number of years. Maybe they'll stop it at age 3 and your oldest nap till age 5. So that's something to consider as well, siblings. Interestingly, the next one is kind of self-explanatory, longer nighttime sleep, right? So some kids can sleep longer periods of time overnight. In fact, as children get older, this is pretty normal. The sleep consolidates at night and then they don't need to take as long of naps during the day. I do want to put in a point here about cultural differences. Research does show that cultural and racial differences do play a difference in nap needs. For example, research shows that children in European countries might stop napping before children in Australia and Asian countries. Also know that children in European countries are less likely to nap after 24 to 36 months of age, so 2 to 3 years of age, compared to US children. In terms of race, we have data that shows that Black children actually stop napping sooner than white children do in the US. And lastly, science is showing us that differences in brain development is another reason that children might stop napping early. Now let me explain. There's a specific part in the brain called the hippocampus, and that helps with memory consolidation. Think of it as short-term storage for your brain's memories. The cortex is long-term storage. So during napping, during sleep, we're able to actually move our memories from the hippocampus to the cortex, short-term storage to long-term storage. Researchers found that children who are still napping had a hippocampus that was less mature, and they needed that nap to really empty out their hippocampus, put it into their cortex, and then make more memories. Now, children with a more mature hippocampus can wait until the end of the day and then empty out that hippocampus bucket into nighttime sleep into their cortex. Now, if you're confused or that kind of went over your head, just pause for a minute, go back and listen. But essentially what we're talking about is when your child is sleeping, you're actually able to empty that hippocampus bucket and then be able to store those memories in long-term storage. With napping, that gives a child the ability to do that during the day and then at night. If your child stops napping, perhaps they're able to have a larger reserve in their hippocampus and then empty out those memories at night for long-term storage in the cortex. Researchers have found that children who are still napping may have a less mature hippocampus and need that additional emptying time. Does that mean that if my child is still napping, their brain development is delayed? Not at all, not at all. There's small, minute differences from child to child. And honestly, if your pediatrician's not worried about development, then this is something that's just unique to your child. All children's brains develop at different rates. The memory storage and emptying it out, that's just something unique to your child's brain. Obviously, we know napping can also help with other memories. It's not just memories during the day that your child accumulates, but learning language, memory solving, cognition. All of these things are super important when it comes to your child getting the adequate rest that their brain needs. Not to mention, you and I probably both know that napping improves your baby's moods drastically. So if you have questions down below, or maybe your little one has already dropped a nap and you're curious as to what it could be, let me know. Drop a question in the comments. If this video was helpful, give it a thumbs up, share it with somebody else who might be going through the same thing. We all want our little ones to hold on to naps as long as they can, but honestly, I recommend sometimes that if your child's ready to let go of that nap, that's okay. Let them consolidate and get longer sleep at night then. Just make sure you're able to give them that longer sleep. Unless, for example, you know that they're not going to be able to, then maybe you can fit in a nap then. All right, guys, I'll see you next week. Bye.